I want to welcome now Nancy Brown. She is CEO of the American Heart Association. Nancy, great to see you.
Thank you. Good to see you.
So President Trump is all over the place here in Davos. He had a breakfast this morning. He addressed the crowd yesterday, and he's been very vocal about the dangers of vaping.
Yes.
And I would love your take as CEO of the American Heart Association on what the Trump administration has said about vaping, and is it enough action coming from the White House and from Congress?
Yeah. Well, first of all, I think it's really important to understand that 5 million young people today are vaping. 1 in every 4 high school student is vaping, and that's self-reported data. We have reason to think it's much more than that. So this is a public health emergency. If you think about the fact that combustible cigarette use was at an all-time low 2 years ago, and now these kids are vaping, we need to be concerned. We are concerned about flavors, we're concerned about menthol, and we're concerned about the lack of regulation. The Trump administration, from our point of view, has not appropriately addressed this issue. Their recent guidance that has come out has not dealt with menthol, and it has not restricted the open container vaping devices, which we believe will be the next generation. Industry will see that. They'll go create the next generation product.
I saw, Nancy, the statement that came out around that time from the administration saying, it may have been from the president himself, we want to look out for the people and the industry. Why should we care about the industry at all? The industry being the vaping industry and the tobacco industry.
Yeah. From my point of view, this is the industry that has addicted young people to cigarette smoking for decades. If you look at the fact that most adult smokers of combustible cigarettes and now youth with vaping, people have their first cigarette product before they are 18 years of old and they get addicted. The tobacco industry is using the playbook now with vaping, and we do not believe, for the health of people in this country, for the economy of people in this country, that protecting the industry makes any sense at all.
And that's the Quit Lying campaign.
Yes.
That's pretty strong.
Yeah, absolutely. No, those are sobering statistics. I mean, I have 2 teenagers who do not vape, but I hear that I know of, but I'd like to think it's true. But they come home and they tell me stories, and it is, as a parent, it's horrifying. And I'd love to know what you're doing in terms of partnering with technology, because when I think about the American Heart Association, I don't think tech, but you are partnering with some of the biggest names in tech to tackle things just like this.
We sure are. And, the American Heart Association enjoys a number of important partnerships. And on the vaping in particular, you mentioned Quit Lying, and I just want to come back to that. That is a campaign of the American Heart Association to activate youth against industry, and youth are outraged. In terms of our partnerships with technology companies, those include relationships related to vaping. For example, we were very pleased to applaud Apple for removing all of the vaping apps from the Apple web store back in November. So that was wonderful. And we really see that technology companies are trying to bring their expertise to solve some of the biggest health issues in America today.
Do other tech platforms like Facebook allow for vaping companies to promote their products?
Well, we are looking very closely at where the vaping industry is popping up with ads that allegedly are user-generated, but they're actually sponsored. Yeah. We were very pleased, when Google has done a complete cleansing of their system to try to remove any of the self-generated content that is being positioned, differently than it is related to vaping from their website. But I think the technology companies play an important role. They play an important role because of the reach. They play an important role because of how much young people are focused. And they also play an important role in the broader mission of the AHA in terms of helping people manage their health and health conditions and spurring new innovations in science.
Just to follow up, you don't know about Facebook, whether or not they have those ads on there or not?
I don't know whether Facebook has the ads on there or not.
And let me ask you just generally about hypertension and health statistics, which have been going the wrong way, quite frankly, over recent years, which is surprising, of course, because we think of progress as just inexorable. But in fact, there's been this downturn. Why is that?
We are very concerned about the downturn. For decades, the past 4, as a matter of fact, we have seen a constant reduction in deaths from cardiovascular diseases and more recently strokes. That has had an uptick largely because of uncontrolled type 2 diabetes, obesity, and this rising rate of people with uncontrolled hypertension. And it is a real health concern. And the reasons are many. You know, first of all, we have many people in this country without access to high-quality, affordable health care. And we know that individuals partnering with healthcare providers is very important for tackling some of these issues. We also know that people in certain areas like rural America, as an example, really struggle with having the social environment that allows them to appropriately manage their health care. We'll be publishing a really landmark paper in about 3 weeks on the state of health care in rural America, and it is eye-opening when we think about the problems that we're facing.
Because heart disease is actually up in among younger people,
yes,
right?
Yes, it is.
What age, when you say younger people, what is that?
You know, I think what we need to recognize is, you know, many people are at risk for heart disease. It is the #1 killer in the United States and globally. 17.5 million people a year.
For both men and women?
For both men and women lose their life to cardiovascular disease. We see younger people, because of these health conditions like sedentary lifestyle, obesity, and type 2 diabetes, being afflicted earlier with heart disease, younger women having strokes. And so this is a real call to action to our communities, to our healthcare providers, and to individuals of the importance of managing health, including mental health, you know, which is so important for individuals having, you know, not just good physical health, but good mental health.
Hey, Nancy, how does the AHA work? In other words, how do you get your fundraising? Do you have an endowment? Do you have to raise funds from private companies every year?
The American Heart Association raises and has revenues of just under $1 billion a year. Wow. And those dollars are generated largely from philanthropic sources. We are America's largest health nonprofit organization when we think about our sister organizations. We also have some product lines where we are bringing products to market, like CPR training as an example. And part of the beauty of the American Heart Association is we are creating the science that becomes the guidelines, so we're able to very quickly get appropriate products into the marketplace to help individuals and healthcare systems manage the health of people.
Well, Nancy Brown, CEO of the American Heart Association, thanks so much.
Thank you.